All right. Hello, everybody. My name is Parody Jody, and I'm the Contracts Administrator for the Community Partner Program. I want to take this time and record some information here about the monthly activity report because consistently we have ongoing questions about how the report operates, and at that time I'll go over how the report operates, how it's laid out, and I'll also go over one by one what the deliverables are, what we're asking of you is within the report. Right now, I want to go through the contextual layout of the report. Looking at the report just visually, we have in column A, we have instructions. So if you have any questions about what O1 might be, if you look to the left, there is instructions on what we are asking of what O1 is and what we'd like you to report on. If you look through this a little bit more and look to the far right hand side and you see that burnt orange color, every box that has a burnt orange is going to calculate for you. So please you're not inputting any information into the report when there's burnt orange color there. So it will do all the calculations for you. In some of the fields there are some equations in there also that will calculate for you. So please don't input in any information in those burnt orange colored boxes. Also looking at this, we have there's instructions. Obviously, you can see there's instructions highlighted here on the yellow of where you find column A. And can you go up a little bit here? And their report form instructions and /tips are in column 1A also, just for you to kind of navigate you on. As we go down a little bit lower, as you can see, the report is split up into if I remember correctly, 3 different spots. We have outreach, we have referrals, and we have 4 parts. We have enrollment and renewals, and we have system navigation. So there's 4 components to this part, to the first tab. And as you can see, the below left-hand side, we have 3 different tabs here. We have quantitative, we have qualitative, and we have trainings and meetings. So we have 3 different tabs. This is a pretty basic report. The qualitative part tab is obviously where you're going to be inputting your data. The quantitative part is where we want you to put narrative, explain to us maybe some different outreach activities that you're doing. A lot of the outreach activities that you're doing, the narrative will go in the qualitative part to kind of back up what your data is that you are reporting on in the quantitative part. Excuse me. And the third tab is the trainings and meetings tab, and this is where you want to put all your trainings and meetings that your application assisters are taking, so we can track that and report that internally to our executive staff. So if we go back to the qualitative part, let's move up to, let me see here. Yeah, let's move up to the top, Jess, thank you. Looking at the first part, I have this template that we're working on is a template for the Cover All Kids grantees. It's a little bit different, and I'll talk when I get to the part where it is different for our community partner program, our CPOP general grantees, I'll call that out. But this is I wanted to use kind of the most complex monthly activity report, and this one is based for our Cover All Kids Hub members. Okay, and this kind of gives you an idea of who your lead organization is. On top, that's where you want to put your name. If you're a regional hub grantee, and we have 2 of them, underneath is where you put your regional hub partners. Again, and there's the instructions tab there. So looking at the blue part, we have outreach as our first component. We have outreach within clinics, we have outreach within schools, and we have other. So any other kind of outreach you're doing will be going there. Looking at the first O1, as you can see, O1 is looking at this. We are asking what your total in-person meetings are. I'm not going to read through every instruction. It's there, but again, I think it's pretty self-explanatory. Total number of in-person meetings you are having within your outreach outreach activities. As we move through there, within those outreach activities, the total number of individuals reached through the in-person meetings. So obviously the total numbers of individuals in that meeting. All right. O3 is a total number of incidences of tabling, presenting at community partner events. If you're going out and you're doing, again, any tabling and presenting, we want total number of incidences. Again, that is the total number of people that you are communicating with. If I'm communicating with or I'm tabling with one person and we talk and they leave and then they come back again an hour later and you have talk with them again, that would be 2. Total number of incidences. So I want to try to clear that up a little bit. So you can have multiple incidences with one person if they're coming back and asking you different type of questions throughout the day. Number 4 is a total number of individuals reached tabling, presenting at a community event or forum. In this situation, we are kind of looking at probably you can get that information from the event director, how many individuals are at that event. You can count this by looking at collecting flyers and having how many flyers you have within your table and giving those flyers out, and whatever flyers you have left over, obviously you do some math and you would see how many people you'd reached. So there's different multiple ways of tracking this. You can have a clicker. So there's different ways of go about doing this. Again, with these top outreach activities, if you have any questions or the best practices, just feel free to reach out to your ROC or me, and then we can kind of go through what is the best way to count this, depending on what type of outreach event you are conducting. O5 is total number of OHP outreach and outreach and marketing materials distributed. So again, total number of outreach materials are distributed is pretty self-explanatory. I shouldn't need to go over that. O6, using radio, TV, social media, and other for outreach, total number of individuals reached per media type. So this is where you can see more of the burnt orange color fields that are coming into play. Again, please feel free, do not put any information in there. Those will calculate for you. But if you're doing radio ads, please go ahead and if you don't know how many the reach of that radio ad, please speak with the promoter or whoever you're working with within that organization. They can tell you their full reach, what counties there are. Same with TV, social media. Obviously, you're going to look at the likes and the viewerships of whatever you're posting on social media and others. And obviously, there's other types of media outlets also.
I've had people ask me if phone outreach is something they can report here.
Phone outreach for marketing. I mean,
it's like cold calling individuals on a list or something like that.
Oh yeah. Let me see here. So those would be interesting. I haven't got that question before, but that's where I would put them. I would put them in the in-person meetings category. I would not put them down below down where the radio, TV, or anything in there. That'd be definitely, if you're cold calling, that's an in-person meeting over the phone. And obviously that if there's, if you're talking with one individual and that individual says, yeah, I have four individuals within my family, and they talk through those individuals within their family, and they say I have a wife and kids, we're going to count that as a total number of individuals that you're connecting with for that conversation. So good question, actually.
Thanks.
Yeah. Let's see here. Let's go down to see we're at 07. Through all outreach activities, obviously combined total number of individuals reached, that's going to calculate for you. And 07A will also calculate for you. There's not an algorithm, but there's an equation in there that will that we've received, and internally we put that in here and it'll go ahead and calculate for us. So don't feel like you need to do anything there. So moving down, referrals. So 08, we want the total number of individuals that are referred to you. So these are referrals to you from outside organizations. So if you have a big organization, you have multiple programs within that organization, you're referring clients from one program to another that is not classified as a referral. If you have an individual coming to you from outside of your organization asking you for assistance, and that individual says, yeah, I heard you from a TV ad or social media, or I'm referred to you by another local organization, that's where you would put this. If the referral was from a clinic or school, obviously you'd put the tally mark wherever that individual came from, or if it was different than that, you'd put other. 09 is really for our Cover All Kids grantees. Our Cover All Kids grantees have hub members and underneath them, and this is where we have this within their work plans of doing warm handoffs from one organization to another to help do application assistance or system navigation. So 09 is for our Cover All Kids hub members. So again, that you'll know who you are, and that is 09 is for you to collect that data from.
I have a question. Is that where the referral is coming from or where it ends up for the clinic and school?
Where that referral is coming from.
Okay.
Yes.
So if you're a school partner and a clinic partner reaches out to you, just as an example, you would mark
perfect
a referral from a clinic.
Yep, most definitely. Good question. All right, so our referrals our information is pretty simple, just two questions there. Now we have our enrollment / new applications and renewal applications. As you can see, to the right side, we have OLHC, we have different community partners, different hub members here. And this is for our Cover All Kids monthly activity report. If you're a general CPOP grantee, it'll just be one line. It'll just be where it says OLHC, it'll be total. And that's, you just put your number right there. So, but again, if you're a Cover All Kids or hub grantee, this is what it's going to look like. We want to know the total number of application assistants through the one application assisted through the one system. Then we want the total number of applications assisted via paper or PDF application. Pretty self-explanatory there. So E3, the total number of individuals assisted with the new application. So the total number of individuals within those new applications. So if you have one application, and within that one application, we have 5 members on that application, that is where we put the individuals there. Then out of those 8 individuals within that application, how many of those kids were Cover All Kids? And right here is where you'd put that number. Maybe Jess can talk a little bit more about this, but the best way to get to that number is if you're processing an application within the one system currently. And Jessica could probably talk through this a little bit more. I will say if you're helping enroll an individual, it'll give a designation for that individual as a Cover All Kids kid.
Yeah, I would just add that we are not asking you to positively identify, like ask people to out their immigration status. So if you're not seeing something that says Cover All Kids within the application, use your best judgment and reach out to your ROC if you're not sure.
Right. So E5 is total number of incidences for people declining application assistance for any reason. So we just want to know for any reason, how many people declined application assistance. Again, that's pretty self-explanatory. And again, to the left is examples of what that scenario could look like. E6 is the total number of renewals assisted. So renewals is kind of an interesting topic. A renewal could look like multiple things. And just could back me up after I talk through this to maybe get some clarity on the application assistance process. But if an individual comes in and wants to help with a renewal, maybe they got a mailer. I know that renewals, there's that you help them look up information for renewals in the system. Asking simple questions and getting answers for them regarding their renewal process. This is where you would tally mark this. Any type of renewal assistance is going towards your number of renewals assisted for E6, where it's pretty broad and lenient because there's so many different ways the state reaches out to individuals to get them renewed again to move them forward for the next year of eligibility for a medical. But we wanted to be lenient. We wanted you to kind of not get the points, but we wanted you to be able to tally mark one for E6 anytime you assisted a family with any type of renewal question.
Yeah, and we recognize that renewals can take a bunch of different pathways in the world that we're in right now. So it could be that someone comes in not understanding the paperwork they got, and they might not even have to take more action. But if you took the time to sit down and explain what their next steps are and what they need to do, we want you to count that, whether it's a full renewal where people had to send all of their information in, or just one piece of information, or even just getting clarity on what the process should look like.
Yes. So along those same lines, E7 is the total number of individuals within that application. Again, you obviously in some of these scenarios use your best guess of determining that number. So again, I know depending on what avenue these individuals are coming down or what type of questions they're asking you in regards to your renewals, you don't need to go out of their way and start asking them. So how many people in your family, and are they eligible? Are they cover all kids? We don't want you to go down that road. If you're assisting them, take your best guess to how many individuals are within that family, and you can move on from there. Again, same thing with E8. We want you to do your best you can with determining if there are any cover all kids individuals within those renewals that you're assisting with. And last but not least, system navigation is a big thing. We want system navigation is one big number. So if I'm helping an individual out doing their application, that is great. After they're done with their application, they come back to you. They have questions about navigating their health insurance. What is my primary care doctor? How do I get a hold of them? Do I have dental insurance? All those type of navigation questions. This is where you would continuously telemark that number here. There can be obviously multiple incidences for one individual coming back to you and you helping them. So again, that is very important that you continuously tally mark the system navigations you have per individual throughout the whole experience of getting them enrolled or talking about getting them enrolled all the way to the end of getting them, helping them navigate their health insurance. We do, on that note, before I forget, we do understand that system navigation is a huge thing. And a lot of times system navigation takes away from processing of applications. A good thing that you could do to kind of move forward and is to go here and go on the qualitative part of the tab. And if you spend a lot of time in helping individuals navigate this system, this is where you want to actually put your narrative down. If you want to say, we helped 10 individuals, or we processed 10 applications, but after that we had 150 system navigation occurrences, and out of that took us 20 hours this month, or it took us 30 hours. It really was it's a time suck. This is where we need to know that type of information, because it really does reflect on your total data that you're inputting in the qualitative part. Along those lines, obviously we're done with the first tab. We're going on the second tab. Again, this is kind of where I talked a little bit about how you would use this part of the monthly activity report. It is where you want to expand upon any of your outreach that you're doing. Let us know, feedback of comments of how things what went well, what didn't go well, explaining possibly some of the data that you reported on, whether it's high or low. That helps us out tremendously. And obviously, there's some lists of schools and safety net clinics that you are focusing on for your 100% project, and really kind of dialing in and putting more detail here with narrative around your monthly activity report. This is where you want to put it. And did I miss anything here, Jess?
I don't think so. I think the one thing about the report that I've seen people consistently underreport is you might have one interaction that starts as an outreach interaction, and then you switch gears and you help someone with, say, a renewal, and then you have some questions that you answer about how people can use their
Right.
CCOs or something like that. Is that do not be afraid to count one interaction 3 or 4 places if that is appropriate.
Right. Right. Yeah, it really is. It's a interesting thing that everybody works differently. And if I had an interaction just like that after that client left, I would kind of think through what I've done, where that conversation went from A to B, and then kind of tally mark and keep record of those conversations using tally marks for myself. So again, everybody operates differently, but yeah, Jessica's definitely right. You can have one interaction and you can have multiple different tally marks for your quantitative part. And as we move on, again, this is the most basic part, is the trainings and meetings. We want to make sure that everybody's at their collaboratives. Everybody has taken part in our monthly webinars that are the third Thursday of each month from 2 to 3. There needs to be one individual that is on that webinar. So this is where you put that information in so we can track that. As we move back, I believe that's all that I have. Do you have any other questions that have coming up that I can answer, Jessica, out there in the field?
I feel like we hit a bunch of them as we went through.
I would just like to say, if you have questions, please, please, please reach out to your rock or to me, and we can go over this easily, line item by line item. I can talk you through. If you have different, I know scenarios are so complex, and when you have those tricky scenarios, please give us a call and give me a call or email me, and I can answer any of those questions. With that, I would like to wrap it up. Have a nice day, and thank you, everybody.